Thank you very much, Kira. As always, a brilliant presentation. Thank you very much, because there's a lot of information here for us to discuss. And thank you also for giving us the opportunity to have all the evidence and the material that you already have in order to continue our job here. And before we have some minutes to open the discussion to the whole forum, let me ask you something. You said in the it was like a couple of slides before these. I wonder in terms of, right here, thank you very much. I wonder in terms of, I mean, our job is to discuss about the framework in terms of educating health professionals. What would you recommend? What would PAHO has already done in terms of looking at the curriculum that we need to look now and to see what would be the specific recommendations to actually include in the curriculum, or to do something different, or to talk about the strategy that we're doing, the communication with other professions, specifically in the education part of the health professionals? What would you have to say about that?
Yeah, so again, I want to, the reason why I mentioned the health in all policies is that, and again, you know, time is short, so I should have expanded a little bit more on that. But the health in all policies capacity building that we're doing at the moment is actually very, very important for education professionals. Because I'll tell you what we did in Suriname. In Suriname, that was the first country to really implement this health in all policies training course and really get different actors together, different sectors together to look at how this manual could really help them. The one proposal that came out of this particular training was really to integrate that into the master education in the Caribbean. Okay, so right now, what's happening is that our colleagues, the ministries, are actually negotiating with our colleagues in the Caribbean to see how that can be adopted. So a very practical tool. And again, these tools, they exist, and it's important that we draw upon that and we draw upon the lessons learned from that. But those tools exist. They're very user-friendly. They speak to our imagination as well as to how we do this in practice, because we sometimes get a little disillusioned. We sometimes feel we have to sort of, you know, as one of our colleagues said, we have a big task in front of us. We have to change the world. This is a very kind of concrete tool as how that can be done. And it's a tool that can be incorporated into the curricula. And this is what they're working on in the Caribbean. And then I will also say that we also have, of course, networks of healthy universities. And I think we need to draw upon those networks as well. There is a large committee of very, very committed health professionals that are really sort of arguing for the need to really make sure that social determinants of health, health in all policies, equity becomes more part of the curricula. So really draw upon those different networks that exist.
Thank you very much. From the committee members, do you have a question for Kira? Go ahead.
Just as a point of clarification, sorry, Dr. Julian Fischer from the medical school in Hanover in Germany. Excellent presentation, and considering it's not your mother tongue, extremely well delivered. Just two things really. Has PAHO mapped the health on the SDGs? Because obviously, as you were saying, if we're talking about intersectoral dialogue, it's easier to have that dialogue if you're coming from health and you can see where it's mapped. So that would be the first question. The second question, Ilona's manual is excellent, and I've looked at it in detail. And I think it would be a fantastic tool to bridge, as you say, because quite a lot of health profession, health workforce education gets you to the community, but all the problems lie in policy, or many of the problems lie in policy, and there's no bridge to do that. And I feel the manual would have an excellent role for us to have a look at potentially in this framework. So the two questions were, have you mapped health on SDGs? And is there any ongoing work that we could draw upon looking at how that manual might be drawn into health workforce education? Thank you.
Thank you. That's it's an exciting question for me, Dr. Fischer, because today, right now, at this very moment, we are actually launching the analysis that we have done on health within all the SDGs. And I would like to share that publication with you as well, because I think that's a very important publication. But that is also why I mentioned the task force, because the task force is, I mean, I said, at the moment I live, eat, and I drink the SDGs. So sometimes I will speak very sort of to myself, which I need to learn not to. But what is important about the task force is the work that we have done, or they have done, is really they have analyzed all the different SDGs with all its indicators to really map where does health come in. And we have that analysis. It's in draft right now. But again, something that we would love to share. We also have a set of recommendations that have come out in terms of how, what are the opportunities and how do we address health within the SDGs. There was one more thing. Yes, and we also have a reference note that was drafted during our last meeting that is now open for consultation. So we very much welcome your thoughts on that and your comments on that, in particular in terms of education. I think that would be very helpful as well. The manual, we are rolling that manual out at the moment. We have conducted one training in Suriname. The last training we did was in Mexico, and now we are conducting a training in Brazil. Each training has had a very different audience, and there is a reason for that, because we really need to make sure we sort of reach different stakeholders, if you like. For instance, Suriname, it was much more about really drawing upon the strength of these different sectors working together. And really sort of defining common ground in terms of moving forward. There's a lot of experience going on in terms of what we call the UNDAF process, so really working as one UN. So really sort of further strengthening that and see how we could strengthen that in the rest of the Caribbean. And then, as I said, there are now currently negotiations going on, because there was a lot of interest from our different government officials, actually. So now these different negotiations are going on with the universities, sort of really to see how that can be incorporated. And then I would say in Mexico it's very different. It was really to really establish and strengthen the network of trainers to make sure that we actually have a sort of a pool of trainers that we can really count on if there is a need. And then what we're doing in Brazil is very different again. These are really professionals that are very, very sort of on a daily level, they engage with the social determinants of health. So it's really to sort of see how we can further strengthen that and to what extent we can use the manual. So again, there are different sort of perspectives, and it's by no means is this manual cut in stone. And I think I want to stress that as well, because we all know that context is, this is of utmost importance. And that's also why each capacity building has been very different. I think that's something that to be taken into account as well. But I do think it is a very unique tool that can be used in developing this framework further.
Thank you, Peter. We have time just for one or two people from the audience. So
yes, thank you. My name is Pierre Laramie. I'm the Executive Director of Medical Education Cooperation with Cuba. And the question I wanted to ask you has nothing to do with Cuba. It's about how health and all policies and all the work that PAHO is doing in this area and in the SDGs relates to PAHO's commitment to universal access to health. And I have some awareness of that because, as you know, PAHO worked with MEDIC. We translated a special issue of the Lancet into Spanish on universal access to health in Latin America. One of the things that was brought out in many of the articles in that issue was about the relationship between access and equity.
Thank you very much. It's an honor to meet you in person. I have heard your name. It's a pleasure. And of course, this is something that's very important as well to us. Universal coverage is extremely important. We have just again had a specific strategy was adopted by our member states. That really did require a lot of negotiation. What is very important is that particular strategy has, it consists of 4 components, one of them being that of the social determinants of health. So it's also to say that we recognize that health does not just happen within the health sector, but we really need to think about those social determinants of health. So it relates very much to that. We work very closely with our colleagues, and I think again, when we talk about health in all policies, we really need to think about the importance of other sectors, the importance of the community when we think about universal health coverage. So it's a very important point, and I should have mentioned that as well. So thank you for bringing that to my attention.
Thank you.
Well, thank you very much, Kira. I hope you stay for for some time so we can chat with you informally during the break. So thank you very much. It was very useful, all the information, very important issues you raised. Thank you.